Thank you for calling BJC Infusion.
My name is Cheryl. I'm a pharmacist for BJC Home Infusion. People that are a lot of times in the hospital, although sometimes they come from home also, they need a therapy that is maybe not available or not as effective by mouth. And so what we do is they'll have some sort of an IV line in them, and we provide medications for them through the IV line.
This is Cheryl. She's the pharmacist, and she just wanted to talk to you since we changed your medication last.
We work with people who have cancer. We work with people who have some sort of an infection that requires IV antibiotics. We work with heart patients who require medication to help their heart keep pumping. We work with children for a different variety of reasons. We work with people who are not able to eat by mouth for whatever reason, and so we feed them intravenously. It's really a wide population of patients.
So you're pretty much pain-free from one treatment to the next now.
That's
awesome. That's really good, yeah.
It's really a team. We have our intake people who coordinate with the discharge planners down at the hospital, and then the intake people communicate to the pharmacist what needs to be done. We have our home patient representative who calls the patient to check the supplies. We have our nurses who come out to the home, and we have our nursing coordinator at the office who helps set up the visits for the nurses. We get our referrals from a lot of different sources. Probably the main source is people that are in the hospital and they're going to be going home. So that's one source. Another source would be directly from doctors' offices. We have had patients actually call us looking for a home infusion company and self-referring, and then we can contact their insurance, make sure that we're an approved provider.
4 more saline hundreds.
There's a lot of checks and balances all the way through the system.
Okay.
First of all, making sure you've got the right medication. We will double check, our orders against what we've entered into the computer. And then when we go back to the laboratory area, another pharmacist does a final check, making sure that not just the product is correct, but the label directions are correct, the quantity is correct, how it's been mixed is correct, and then putting that together with the supplies to make sure that the patient has everything they need in the home. We do have nurses that go into the home to teach the patient or caregiver how to infuse the therapy, and we also have drivers who make the deliveries to the patient's homes. I would recommend for patients and their families to use BJC Home Care because I think that we are really committed to making the best outcome for the patient. That's what we keep in mind. We want to make sure that they know how to do the therapy, they're comfortable with doing the therapy, they know they're going to get their deliveries when they need them, that we'll be working with their doctors closely to optimize their therapy, and we're available for any questions.